at 97.3 FM, WVLK. I saw this funny story about all these retail stores mandating face masks. And now you don't have to wear a face mask if you have a medical condition, and the stores are not allowed by law to ask you about your medical condition. So if they ask you to put on a mask and you say, no, you have a medical condition, they have to let you in. So what are the chances of all those people in Walmart with, quote, emotional support dogs, unquote, having medical conditions too? I don't know. What do you say, Dr. Kevin Kavanagh?
Well, I'll kind of say that's maybe somewhat of a problem. I know the emotional support dogs on airplanes and in restaurants can sometimes be a problem, and that's with quotes. It's not if they're truly an emotional support dog.
Right.
But I don't think they all are. And of course, animals have been implicated in possibly transferring this virus, although they think it's very low chances. They need to be treated the same as family members. And I'm not sure how we'll work through this. And this is one of the reasons why it's up to personal responsibility to make sure that we follow public health guidance. It's extremely important. Cases are skyrocketing. This is not a joke. We do have treatments to avoid death, but we're hearing more and more about chronic long-term problems of people that had this virus. And remember, this virus attacks every organ in the body. It's not just a lung virus, so it's not the flu. We need to take it seriously.
Yesterday, the governor reported the highest one-day total of coronavirus cases at 979, 3 deaths. And that is, I guess, in spite of the mandatory mask order. Is there any correlation there between the two?
Well, there will be, but the problem is that there's such a lag time, people can't see it. And this is what makes this pandemic so difficult, is that you have asymptomatic carriers and an extremely long incubation period. It can be up to 2 weeks. So by the time you're exposed to somebody, it's 2 weeks. Then you develop mild symptoms. It might be another 1 to 2 weeks until you get sick enough to be in the hospital. And then another 1 to 2 weeks until, if you were to die, that would happen. And of course, now with the treatments we have, that is much less likely. When you have remdesivir, you have antibiotic serum, you know about steroids, that has really helped us mitigate deaths. But that's, of course, making sure that we don't overrun our healthcare system with too many cases. However, those people that get sick, sometimes even mildly sick, are reporting having lasting problems. How long do they last? We don't know. We haven't had this virus with us that long to really have that knowledge. But that's one of the reasons why we need to respect this virus. We just don't know, and everything we've learned about this virus has told us we need to respect it and take it seriously.
So when you start talking about increasing the number of tests that are given, and the argument then becomes, sure, we're going to have more cases because we're doing more tests. Is that valid?
Well, over the short term, yes. But as you increase tests and identify cases, people can self-isolate. You can do contact tracing. And testing is the way of driving down the cases in the epidemic. That's why you're doing tests. You're not doing it just to tell if someone has a virus. Once you find someone has the virus, you do something about it. And if we don't do something about it, it's going to spread like wildfire. Now, because the deaths are dropping, the best metric, I think, is going to be hospitalizations. And that's what we need to look at. But when I say deaths are dropping, what I really meant was our fatality rate. If we have so many cases, that's going to go up. And we're seeing that. Last week, according to Worldometer, one day we peaked over 1,000 deaths in the United States. And this is up tremendously over what we had before. We were starting to really crush the curve. And of course, with all our partying, all the demonstrations, all of the rallies, all of this, I think, resulted in a resurgence of the virus, because the virus doesn't care about any of the reasons for those activities. If you do an unsafe activity, you get too close to someone, especially if you do it indoors and you're not wearing a mask, it will spread that virus.
But now, before bipartisan negotiations even begin for another coronavirus relief bill, the White House administration is reportedly pushing to block billions of dollars from states to conduct testing, and there's also an effort to block billions from the CDC, the Pentagon, and the State Department to address the pandemic. Washington Post says that the White House move to block funding in any new coronavirus bill has angered some even GOP senators who want to use $25 billion for states to conduct testing as cases spike throughout the United States. What do you say?
I would side with the GOP senators who are upset at that happening. I don't think that's wise. It will not be helpful. We need to do testing. We need to make sure that we can identify and have those people self-isolate. We need to drive down the curve, because if we run out of supplies and remdesivir and serum, you're going to see that death rate skyrocket. We'll be right back to where we started from. And yes, it's currently circulating in the younger people, but all expectations are it could jump to the older people. I mean, we know how to stop this epidemic. The fact that we're not implementing those strategies, to me, is just mind-boggling. And it's not a partisan issue. It's not Republican versus Democrat. People just need to look at what's going on in other countries. Go to healthconference.org and listen to the experts from other countries. They don't have a dog in the fight of what goes on in the United States and who's the political leadership. Look what they've done in other countries. And the key message is their populace followed a strategy. And you either are going to need to have to, at this point, do closures or wear masks. And either one could work. You could do closures, drive the virus down to about 0, and then do contact tracing. That's what was done in the Netherlands. Or you could wear masks. We have modeling that suggests that will allow us to have our society open and function. But we did not follow public health guidance. We are now in a kind of a world of hurt, and we're going to have to take the medicine, and the medicine is wearing a mask.
You went and had the test last week, right?
I did, and that's because I need a procedure tomorrow. So hopefully I'll be here Wednesday. If I do, I may not have a real good brain filter. So be warned. You may have to have this on a time delay. So I'm telling everybody up front. And of course, my greatest fear is because I've got a medical condition and have to go through tests and things, is that I'll come down with COVID-19 and everybody will say, well, here's this guy on there for 6 weeks or 3 months telling us how not to get it. And what happens? He got it. Well, no, I'm in a high risk category and I have exposure that's unavoidable. And so you all need to remember that advice keeps you safer. It doesn't make you completely safe. And when you're older, you've got healthcare conditions, you can't be completely safe. And that's why everybody needs to respect public health guidance. But let's talk about the test. It was simple. We called up, made a reservation. That was it. We showed up. There was one car in front of us. We pulled up. I showed the gal my driver's license through the window, rolled down my test. She was in a full kind of moon suit with a face mask plus a mask, stuck a Q-tip in my nose, didn't even touch me, took it out and left. And that was it. There was like virtually no contact. Believe me, you would have greater chance of getting an infection going to Kroger and go shopping, and granted your chances there are small, than having that coronavirus test. So I do encourage everybody to get a test. And in Kentucky, my test is going to come back in 2 days. It's not going to be the 2 weeks that is in some states and 1 week, which is common in some of those states that are being overrun. And so you can do something about the test. And of course, I was negative. I haven't heard back. They said I was, would be called in 48 hours if I was positive. We are very, very lucky at this point. It is still under control here. I mean, the rate of positivity of our tests are still under 5%. Things are going up both in cases and a little bit in hospitalization. So it's very concerning. And we need to act now before it spreads into our state and we get in a world of hurt. So I would definitely follow the governor's guidance.
Real quickly, tell us about the large new study from South Korea involving children.
Well, there was a large new study in South Korea involving children in schools. And this was very, very interesting. It's the first really good study we have. What they found was that children under 10 were half as likely to transmit the virus. And so that is some hope that you may be able to open up schools, especially if you have rates driven downwards. If rates rise, then that's an entirely different situation. Now, there are some caveats to that. Some people say, well, that's because they're smaller, they breathe less air, therefore they spread the virus less. Other people have said, well, they didn't look at asymptomatic carriers, they're younger, they may just all be asymptomatic carriers, who knows? And then there are also those that have stated that it's important to open up schools when it is suppressed or at a nadir, because if you open up when the virus is really surging, as Israel did, you might be in the position like Israel of having to close down your schools again. So there's a lot of things that need to be looked at here, but what we don't want to have is our children being guinea pigs, but we also don't want to have them staying at home and not learning socialization skills. So my opinion is you need to get the parents involved with the decision, have multiple tracks, and the parents can be involved in deciding which track would be chosen and best for their child. Because at this point, we don't have good evidence.
And in this study, those between ages 10 and 19, they found spread the virus at least as well as adults do. Hey, thank you very much. Good luck tomorrow. We'll talk to you on Wednesday.
Thank you very much, Jack. Appreciate it.